One out of every two men watching this video will start to lose their hair from their 20s and will lose their hair mostly or completely in their 50s. Of course, we are familiar with hair loss in men, so this is hardly surprising, but at the same time, one out of every 5 women who watch this video will lose their hair over time. Depending on age, and 1 out of every 2 women will have a hair loss that can be seen on the scalp after the age of 50. So, no matter what gender or country you are from, we will lose more or less hair. Of course, the most advanced form of this is complete baldness in men. Good, but why? Why are we losing our hair? According to data from Egypt, it is estimated that people have sought a cure for baldness for about 5,000 years. Hair loss is observed in approximately 15% of men and 20% of women due to aging. On the other hand, the secret of whether our hair will fall out or not is hidden in the genes of our ancestors. The tissue we call hair is a dead tissue that grows throughout our life. Hair shaft itself is dead. However, the cells that produce it, namely the hair follicles, are not dead. These cells produce our keratin hair, which we call hair by going through 3 phases. First comes the active growth phase, the anagen phase. This process takes 3 to 5 years and causes your hair to grow up to 15 cm each year. Then comes a period of regression, the catagen phase. This is a process that takes up to 10 days when hair growth stops. Immediately after this, a resting period of about 100 days, the telogen phase is observed. In this process, the hair is shed, the follicle producing that hair rests for 1 to 3 months, and then hair production starts again. Your genes and diet determine how healthy this process is. But in general, it is possible to say that hair loss is a perfectly normal phenomenon. You lose up to 100 hairs a day. What happens in androgenic alopecia, so male pattern hair loss, is the shortening of anagen phase. In other words, the period when your hair needs to grow is very short. Accordingly, the dynamics of the hair cycle changes and your hair starts to shed faster. After a while, the anagen phase becomes so short that even if hair is produced, it cannot reach the skin surface. This causes baldness. In this process, the proportion of hair in the telogen phase, that is, in the shading phase, also increases relatively. For this reason, you may notice that your hair is falling out more while combing or washing your hair. So what's the reason? Inherited, the most common cause of persistent androgenic alopecia is your genes. The genetic mechanism of baldness hasn't yet been fully resolved. The strongest theory at the moment is that it's caused by an autosomal dominant gene, but it may also be formed by the interaction of more than one gene. Hormonally, the leading role of baldness is testosterone, the famous male hormone. More precisely, there is the hormone called the hydrotestosterone, or DHT for short. This is a rather interesting paradox, because the same hormone makes the hairs in other parts of body become prominent of the man. This hair growth, called secondary sex characteristics, is triggered by testosterone, which increases with puberty. It is ironic that the same hormone causes baldness on head. What I have mentioned so far also applies to large extent for women. For example, the hormone dihydrotestosterone, which is responsible for hair thinning in women, because this hormone is also present in women, but in lesser quantity. That's why, unlike in men, hair loss is more limited in women. Instead of baldness, there is a significant reduction in hair volume as a whole. While baldness is a problem for some, it may be a choice for others. No matter what, look at how happy you are and live that way, not what people say.